practice sale broker from Orange County, California. I am a dentist as well as an attorney and broker, and it's my goal at this point to help you get where you want to go with your practices, to help inspire you, lead you in the right direction, and motivate you. So happy listening. Hi, it's Dr. Betty Robin again with case study number 4 today of Would You Buy This Practice? Let's talk about another Orange County practice today. This one was, or is, in Newport Beach, California, in the Fashion Island area. What was my first impression? When I got the phone call to list this Newport Beach practice, the seller was in one of the avocado buildings, which is in the Fashion Island area, and I knew right away this practice would sell very easily. So I just needed to make sure I got all the financials and they were all appropriate and made sense. Should be a slam dunk. There are 3 of the so-called avocado buildings, and they are huge and home to many, many, many dentists, physicians, and other healthcare professionals. Now, if you're going to be in the Newport Beach area, being in the avocado buildings is my personal favorite. Yes, they are getting a little bit older, but they are extremely well located and well maintained and just really classy. Not to mention, quite a few suites have ocean views. That said, what floor you're on does matter because the view you have does make a difference in these buildings, and a full ocean view can certainly make the price of a practice higher, just as it would a house or a condo. So I personally really prefer the avocado buildings over really any other Newport Beach location. So we're off to a good start. A very well-located practice in a very popular location. But let's talk about this location. Bottom line, I don't want you to be confused about my thought that you can absolutely make more money in other locations than a beach city and without the ocean view. There are quite a few somewhat starving dentists in the avocado buildings, and they all hustle for every single new patient they get. And Newport Beach does have people move in and out of the city limits more than most cities. So as much as I like to shop in Fashion Island and like to eat in all the fabulous restaurants in the area, I personally would not pick it as a place to practice. It's just too hard. There's way easier ways to make money, but that's just me. Some of you wouldn't have it any other way. I personally would like to work less and make more money, and then spend more leisure time in the Fashion Island area. But once I got to the practice, it did have a full-on ocean view, which is, it's incredible. It just never gets old. But the practice was quite dated, as many are in that building. Equipment quite old, like, 30, 40 years old. But it was very clean and neat. However, it is a significant expense to remodel and or replace all the equipment and digitize, etc. So, cost you a couple $100,000 more after the purchase price. Okay, the seller interview. This seller was very friendly and matter of fact. He decided he wanted to retire and wanted to get that done in the next 6 months, he told me. And given the location of his practice, his longevity in the practice, and his gross collections, I didn't think that would be a problem. Many of the dentists in the avocado buildings went to USC Dental School, and many asked me, ideally, for a USC grad. Sometimes that's a little harder to accomplish, but when push comes to shove, most sellers just really want someone they feel they can trust and like and leave their patients to. Okay, so next step. Here we go with the top 3 things I think you should always look at when deciding to go forward with a potential purchase. Number 1 in my book, every time, is profitability. We're going to once again use that mnemonic, and I'm still waiting for someone to come up with a better one, but we'll use it for the time being, which is cats in Delaware often ate apple turkey. C is for, in cats, C is for compensation, which is line 7 of the tax return, and it's the doctor's salary. I is the interest, line 13. That's the seller's interest and not yours, so it is an add back, what's called an add back, or you add it to your profitability. D is depreciation, line 14. And again, that's your seller's depreciation, not yours. And you'll start over with your own depreciation schedule after you buy a practice. O is the ordinary income, which is line 21 of the tax return, and that's the profit after everything else is paid. Then you follow that line 19 other deductions over to the statements, and then you pick up A, amortization, A, auto, and T for travel. CIDOAAT. It's not difficult to find those statements. I've gotten that question a few times. Just page back in the tax returns until you see them. It's actually just a list of items, and it's probably usually quite a ways back, like 10, 12, 15 pages back, and the total of the list needs to add up to the amount that shows on line 19 on the first page of the tax return. So it's really pretty obvious. Once you see one, you'll get it. It's not like a regular tax return page. It's more like a list. Okay, for this practice, we were in great shape because the seller had paid off everything. There was no interest, no depreciation, no amortization, and the practice was doing almost 50%, had almost 50% overhead, and the seller was taking home about 50%. The gross was in the mid 1 millions. So, I mean, it really was a really good practice, except for the older equipment. Okay, number 2, we always look at the least percent of collections. Since this seller had a relatively significant gross collection number, and the rent in the avocado buildings is not really unduly high, and his space was quite small, the lease came in right at 6%, which is pretty much perfect as long as the buyer can maintain at least the same collections as the seller. Number 3, now we look at the employee percent of collections. We had a little bit of a problem with this area that didn't really affect this seller, but dental office employees in the beach cities do tend to make more money than in non-beach cities, and a lot more than most employees in the Inland Empire or other remote locations. This doctor had a relatively new front desk who he paid over $100,000 a year. It didn't really throw off his percent because he was so profitable, but if a buyer had any dip in collections, it could become a problem. Paying someone too much, either outside the norm for the position or too much that throws off the entire percentage, is always a mistake. Because had this practice not been located where it was with the view it had, it could have made the practice almost unsellable. So, bottom line, this practice, in my opinion, had 2 problems. First, just way too much competition in Newport Beach. I don't usually like to focus on what other people are doing or on competition and believe you should do your own thing. But most beach cities are so populated with dentists. Pushing a stone uphill your whole career can just get tiring. There are just easier ways to make money. Second problem was the one highly compensated employee, but the other employees were there weren't too many other employees, and they were almost lowly compensated. So in the end, it didn't end up to be a huge problem, but it certainly could. I did like this practice a lot, and if you have to be in Newport, I think this is probably as good as it gets. I'd give it a scale of 6 on 1 to 10, really primarily because of location. I just think nowadays it's just really, really hard. So that's what I think this week. Tell me what you think. I look forward to hearing from you guys. Have a good week. Dr. Betty Robin. Please subscribe on iTunes so we can get